Dr. Brooke Jackson. I'm a board-certified dermatologist. I'm here to answer your questions. There are several types of scalp disorders in African American women. The most common is actually seborrheic dermatitis, which is a fancy word for dandruff. Often we see flakes and scales, sometimes in the scalp, on the brows, and sometimes in the armpits and on the chest. It tends to be seasonal. It gets a little bit worse during the cooler months of the year and is absolutely exacerbated or made worse by any kind of stress. It is also very easily treated, and so you can see a board-certified dermatologist to get treatment for that. The next type, which is very, very common, unfortunately, is called alopecia, and that is the medical term for hair loss. There are generally two categories of alopecia: scarring alopecia, which is usually related to inflammation, where you may have bumps and itching and tenderness, and non-scarring alopecia. And there are many, many different types of non-scarring alopecia. That can be related to thyroid disorder, or vitamin deficiency, or medications. So alopecia is a very, very big and complicated conversation and topic. And so my biggest piece of advice would be make sure that you go see a board-certified dermatologist who can help you sort it out and get you on the right treatment plan. Wash your damn hair. That is the number one. I have a lot of patients who come in and they say the frequency of washing is every 3 to 4 to 6 to 8 weeks. You would never go that long without taking a shower. So just think about it. You clean your skin every day. You need to clean the skin on your scalp on a pretty regular basis. My recommendation for curly hair is don't go any more than 2 weeks without shampooing your hair. You can always start with an anti-dandruff shampoo. However, keep in mind they are very, very drying. So you want to make sure that you follow it up with whatever you would use for your normally textured hair. But first and foremost, don't go more than 2 weeks without washing your hair. The short answer is yes. The longer answer is you want to make sure that whomever is doing the procedure is qualified to do it and knows what they're doing. The challenge with dark skin is that it is easily irritated. And if you irritate dark skin, what happens? You get a dark mark. And the most common concern for women of color is discoloration. And so obviously we don't want to do anything that is going to cause or exacerbate discoloration. And so I also like to make sure that whatever the procedure is matches what the goal is that we're trying to achieve. And I think often with social media being so prevalent, we tend to get it backwards. We hear about a procedure and we go and get the procedure, not really thinking about every procedure has to be customized to the person who's receiving it. And it really has to be matched with the goal that we're trying to achieve. So once again, another reason to go see a board-certified dermatologist who is capable of treating your beautiful brown skin. Start young. What does that mean? Take good care of yourself. So the worst thing you could ever do for your skin is to smoke. Just don't ever do it. Smokers age terribly. Number 2, wear sunscreen. So while black don't really crack, it wrinkles a little bit. So you want to make sure that you are protecting your skin from the sun. Even if you are not outside on a regular basis, sadly, a lot of African Americans are taking high blood pressure medications or diabetes medications. All of these medications tend to make you more sensitive to the sun and potentially at risk for skin cancer. Number 3, take good care of yourself. You want to make sure that you're eating healthfully, and that really should revolve around more of a plant-based diet, avoiding dairy. Ditch the dairy. Dairy is awful for your skin and really just about awful for every other inflammatory process. Dairy is highly inflammatory, and if we think of aging actually as an inflammatory process, then it makes sense that you would get rid of that out of your diet. Exercise. Blood flow is great. It clears your mind. And when you feel better, you look better. Take good care of yourself and have boundaries. People who are stressed tend to age. And most definitely, I've seen a lot of my patients over the last couple of years, because of the chronic stress of these last few years, have really aged significantly. So we want to eat well, get your sleep, make sure you take care of yourself from head to toe. That means mental health, physical health. Never smoke, and see a dermatologist, because then we can start doing some fun treatments to ice the cake. Absolutely. I always tell my patients that your skincare regimen should change just like your wardrobe. And so I lived in Chicago for a very, very long time, and there the seasons are dramatic. And so, just as you would wear a short sleeve t shirt in the summer, you have to lighten your products. And then, when you get your sweaters and your heavy coats and the heat goes on in the house, everything dries out. So, you really need to moisturize a little bit more and make sure that your products are a little heavier in texture. So, just as you change everything seasonally with your wardrobe, you should change your products too. Generally, if you are worried about a skin condition, you should see a dermatologist as soon as possible. Listen, dermatologists are experts in hair, skin, and nail diseases. And so we can really cut through the chase and get you on the right path as quickly as possible. With that said, if you're 15 years old and you're starting to get acne, it's certainly appropriate to start with some of the drugstore medications. But after about 6 to 8 weeks, if things are not working, then I would encourage you to go and see a board certified dermatologist to discuss, and that person can guide you in the proper treatment so that you can get on the road to success much faster than you will ever be able to do on your own, looking at Google and talking to your friends. So remember, dermatologists are experts in skin, hair, and nail disorders.